We now have Camilla from the Financial Times. A question from Camilla. Camilla, are you on the line?
Hi, yeah, can you hear me?
Yes, please go ahead.
Thanks for taking my question. The DG has talked before about possible risks to essential medical supply chains. Are there any specific products or regions or parts of the supply chain that are under particular strain at the moment?
Hi there. Yeah, I think you'd have to say that all elements of the supply chain for many different products are under extreme strain at the moment. That's from raw materials through to production, distribution, and delivery. And there are different reasons driving some of that. Production, in some cases, for example, a lot of the rubber that's used to produce rubber gloves is produced in a very small number of countries. If those countries have difficulties in their general supply chain or have a problem of pushing things into the international market, then the place that makes the gloves may have a difficulty in actually making the gloves, not because they lack the production capacity, but they lack the raw material. So there are problems in the supply chain all along that chain. The simple issue is demand, because our current production of protective equipment and ventilators was obviously pretty adequate to meet global demand before this event began. But unfortunately, the world is not ready for a pandemic. And in not being ready, we don't have the security stockpiles in place that are immediately deployable in order to scale up our capacity to protect our frontline health workers and others. There are shortages of PPE, shortages of ventilators, and other products that are for the medical response to COVID. We also have to avoid shortages in other medical supplies as supply chains come under strain, and that may be because of secondary effects of the virus, which is the shutting down of air corridors, cancellation of flights all around the world. Many of passenger flights around the world also carry cargo. Difficulties in shipping, even cargo shipping with crews are finding it, some shipping agents are finding it hard to move materials around the world. So there's strain on the whole system. We're working very closely. The Director General is, even after the launch of the humanitarian appeal, had a further very fruitful discussions with the Secretary General on dealing with this issue and the huge commitment of the UN system to do everything possible together under Director General's leadership to improve, scale up and deliver to the extent possible the essential supplies that health workers and frontline workers need around the world in terms of PPE, ventilators and other supplies. And there's been a huge scaling up of that capacity. And we will make further announcements in the coming days of further scale-ups in that capacity to deliver. But what we also need is a ramp-up in production and a ramp-up in funding for that material. And I believe the Director General, he may speak to this, will be raising this issue very much at the G20 leaders meeting tomorrow.
And if I could just add that, Mike has outlined what we're doing to address this problem and how we're working with so many different partners, but we need to be clear. The world is facing a significant shortage of PPE for our frontline workers, including masks and gloves and gowns and face shields. And protecting our healthcare workers must be the top priority for the use of this PPE. We're working with technical partners across the globe to identify ways in which we can manage this current shortage while we try to find solutions. But some of these options are not ideal, and this is not acceptable. So we have to all play our part to make sure that we prioritize the use of PPE. We use PPE appropriately, and that is for our frontline workers who are caring for patients.